video is on alcohol issues. We're going to look at both acute issues as well as withdrawal. So the first thing to think about is Wernicke's encephalopathy. And this can happen acutely with severe alcohol intoxication and is a result of thiamine or B1 deficiency. The triad is ophthalmoplegia, so they'll have diplopia and nystagmus, as well as ataxia and confusion. Complications are important to know because that's what's going to cause the most harm to a patient. So they can have autonomic dysfunction, so syncope or hypotension due to the vasodilatory effect of alcohol. You can have peripheral neuropathy. Now, of course, this can happen in long-term alcohol abuse due to B12 deficiency, but it can also be a complication of Wernicke's encephalopathy. And from a cardiovascular system, you can get tachycardia. This is largely a clinical diagnosis, but you can also check B12 and folate levels as an indication for any existing liver disease. Management, give IV thiamine, and this must be done before glucose. IV thiamine, 300 milligrams, is fairly standard, so even if you suspect a patient has Wernicke's, but you're not 100% sure, you can still give it. Thiamine has minimal side effects, but you can run into issues if they do have Wernicke's and you don't give it. Long term, you give oral thiamine, and then you think about what causes it. So you can have B12 and folate supplementations if they're deficient, counseling as to their alcohol use, and you investigate for any existing cirrhosis. Korsakoff syndrome is like Wernicke's, but it's long term, so it's not acute. And this is due to chronic B1 deficiency. The main symptoms to know: confabulation, which is basically the patient just making up stuff. Could be because they don't remember, but they're making up stuff. They say ridiculous things, as well as amnesia and tremor. Now we're looking at alcohol withdrawal. So it's going to be dependent on the time frame. So initially, 6 to 24 hours afterwards, they're going to have tremor, anxiety, they have difficulty sleeping, they'll be nauseous, as well as have agitation. Autonomic, they'll have tachycardia, palpitations, hypertension, as well as hypothermia. As time goes on, up to 8 to 48 hours, you can get seizures, and then from 12 to 24 hours, you can get hallucinations. And these are auditory and visual. Remember, hallucinations are you sense something that's not there. So you may literally see something. You may see a man in a dark robe walk into your room. You could hear things. You can be hearing voices that aren't there. And then 70 to 96 hours, we're thinking delirium. So all your delirium symptoms. Management is per Wernicke's, as well as benzodiazepines, especially if they're seizures. Cirrhosis, see our previous post, but it's irreversible damage to liver with nodule formation. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.